Dr. Vince Lennon. Alabama News Network is on CBS 8 and ABC Montgomery.
Almost every diagnosis of breast cancer in the U.S. involves women, and that's the focus of Friday's Tickled Pink event we've been telling you about all month long. Well, news anchor Tim Lennox has the story of a Montgomery man who also found a suspicious lump. He has more in this Alabama News Network Extra.
Dr. William Jones is the patient's regular physician.
This patient presented with a 1 centimeter mass, firm, solid, non-tender, underneath the left nipple. And in any case, female or male, that has to be worked up. So very quickly, one of my colleagues got him across the street to the imaging center.
About 2,600 men in the U.S. will be diagnosed with breast cancer this year. 440 of those will die. Almost 232,000 women will be diagnosed. Some 40,290 of them will die. Amy Cavett is a mammographer at Jackson Imaging. She conducted the mammogram and ultrasound exams of the patient. She says gender only makes a slight difference with the exams.
Well, the imaging is essentially the same. We take the same images. We use a different size image receptor just because the part we're looking at is smaller. And we use a slightly lesser technique, less x-rays, since there's less tissue to penetrate.
It was really unnerving. I mean, I know there were a lot of women who were going through what I was going through, but I was really nervous and frankly just a little embarrassed.
And I think it's also a little more daunting for men just because they're having to go through something that we typically only associate with women, and they don't know what to expect.
The biopsy was painful, even though the doctor did the best he could to keep minimalizing the pain, but wow, you can look at the picture, the still picture from the biopsy, you can see the needle at the top of the picture, the little white item. The ultrasound image shows that needle, and it hurt. But then again, you know, there was the waiting that was maybe the worst, because I had to wait a day or so before I got any results from the biopsy, and that was unnerving. I was really worried.
And the pathologists do a great job of turning around those cases, and it takes at least 24 hours because it has to process overnight. But within 24, 48 hours, we have the result. In this case, it turned out to be a benign infection.
Well, I can tell you, I was really relieved. You know, there's that tiny mark where the biopsy was done, but that's about all. You know, this Alabama News Network story about male breast cancer has left out one fact, and that is who I, the patient, am. If we
Normalize the audio there, that's a little better. And if we increase the lighting a bit, that should make things a little bit clearer. Yes, it's me. I'm the guy who this summer found a lump in my left breast and went through the mammogram and the x-rays and the ultrasound. Now, my lump turned out not to be cancer, but that's a lesson here for all men. Don't ignore a lump that you find. Now, the majority of breast lumps are found in women, but for both men and women, early detection and early treatment can save lives.
All righty, Tim Lennox.